Well, today we're all thinking of our moms as we approach Mother's Day weekend. Being a mom, of course, is really the best gift in the world, but whether you're a mom or maybe a mom-to-be, the truth is it can be hard.
Last year, Texas lawmakers pushed a bill through that would raise Medicaid coverage for new Texas mothers from 2 months to 6 after the birth of their baby. And now the groundwork is being laid out to extend the coverage to 1 year.
Well, joining us this afternoon is Allison Moore-Bulwer. Allison is the Director of Policy for the Hogg Foundation for Mental Health, which works to bring more mental health support to Texans. And I understand, Allison, that you all want even more Medicaid extension to cover 12 months after a mother gives birth. Can you talk a little bit about this?
Sure. So we and many other stakeholders have been advocating for 12 months coverage for moms postpartum. So while we are very thankful that legislators saw the need for moms to have an extension for the 2 months to 6 months, advocates would really like to see a full year's worth of coverage, because we know that mothers need those supports during that first year postpartum. You know, stress, anxiety, depression, all of those can really emerge. And especially for our moms that are on Medicaid that might have other external factors impacting them and impacting their mental health and substance use needs, we really would like to see that full year coverage to ensure that they get the supports that they need to care for themselves and for their family.
You know, my son is now 2, but I remember having him in that time, specifically after you have the baby. It can be really tough on new moms. We talk about postpartum depression and things like that. How do you hope this helps new moms with their mental health?
Sure. So I think it's important to remember that Medicaid covers moms that are low income. So those are moms that might already have trouble finding mental health and substance use services due to their finances. So having that Medicaid coverage means that they would be able to get all medically necessary services. So if they have a mental health or substance use condition, their services would be covered. So what we really see is that extending coverage postpartum to that full year would just ensure that anything that comes up that they might need extra support for, again, postpartum depression, postpartum anxiety, or a substance use need, that they could get that service covered and they wouldn't have to worry about the cost. So it's one less thing for them to worry about to keep themselves healthy and their family healthy.
Certainly an important issue, and we'll keep following here on KXAN. Allison Moore-Bulwer with the Hogg Foundation for Mental Health. Thanks for joining us this afternoon.